there's a big gap when it comes to infection prevention and control. And what this translates into is weak disease surveillance, but it also means exposure of health workers and patients and communities. So we felt it was important for us to make this a focus of today's engagement as part of the support we're getting through the USAID Maternal Child Health and Nutrition activity, to see how can we bring all the stakeholders to the table, from the regulator to the policymaker to the private health sector itself, to not only just discuss the challenges, but also to really talk about tangible solutions that will address those challenges.
As we are all aware, IPC is the cornerstone of epidemics case management. We are all at risk of healthcare associated infections. We need to stand soldier to soldier and ask ourselves, how can we do better?
COVID-19 spread around the world in record time, okay? It took 1 month, 2 weeks, I think, for it to be everywhere. When you cannot contain an outbreak at source, it becomes very, very hard to contain, especially influenzas or respiratory diseases which spread through air.
The key observation that we have noted amongst the private healthcare providers has been a non-observance of protocols and implementation of the key infection prevention and control practices as should have been prescribed. And this has been due to lack of exposure to these protocols in part, but then also it has been noticed that some of the healthcare providers therein are devoid of information and they are devoid of this knowledge.
You can imagine somebody keeping needles under the bed. You get some people, they can train them. Before you penalize them, train them. Tell them what to do, how to do it, where to do it, and when.
You'll agree with me that we are in era of having infectious diseases. We have had COVID, we have had Ebola, and some of the index cases have come from these facilities. And if you don't have records, that can be a timing bomb.
And also we have a challenge of shortage of PPEs to be used, especially during this time of the pandemic. Those were very important. But that has been a challenge, there has been a shortage.
Due to the systems of how private facilities work, we always have a lot of bills to encounter, which include rent and all that. So sometimes we find that our budget is not really getting into that budget that we can accommodate most of the IPC tools that are supposed to be used. So we end up buying some and leaving out some.
IPC by nature is protective. It protects both the health worker and the client. But looking at protecting the health worker and the client is that the private sector is a big player in health services in the city. About 99% of the health facilities in Kampala city are private in nature. So by being able to protect through infection prevention and control the health worker and the client, that means that you're also able to offer quality services.
Our guidelines of 2013 are still under review, and we hope that we'll have these guidelines complete by the close of this year, so that we can be able to prescribe standards of clinical care practice in this country to each and every healthcare provider. And we're hoping that at the end of it all, we'll be able to institutionalize infection prevention and control.
Let's be intentional to ensure that the different cadres we have in our facilities at least are knowledgeable in IPC. One UHF has a self-paced IPC module, which someone can take at any time.
We've talked to over 1,000 proprietors of private health facilities, and what they've said is the lack of finance is the major barrier to them introducing the IPC measures that would allow them to address these IPC gaps. So as the Uganda Healthcare Federation, we have innovated a mechanism that allows them to access equipment and instruments at an affordable cost. These are instruments and equipment that we are assured of the quality, and we are able to offer payment plans for as short as 3 months, 6 months, and 12 months, depending on the item. We have broadened beyond IPC items such as autoclaves to bringing in items such as microscopes and delivery beds, and really with an interest in making sure that the facility is able to not only get what responds to their need in service delivery, but also addresses the IPC gaps that these assessments highlighted during the recent outbreaks.
Where the private sector has reached, it has come a long way. many years before, private sector was looked at as if it is a body which is just interested in making money. And therefore, they are not supported in any way. Where we are now, we have embraced the private sector.